The abstract that I will share with you is our AMG 701 preclinical studies in multiple myeloma. And the reason why we are doing this study is because from our previous study, we know that BCMA is a very specific target antigen in multiple myeloma. And this study is not just our study, also coupled with other people's study, that we know this target antigen is very good, ideal target antigen for immunotherapies in multiple myeloma. The method we are using is co-culture systems, that where we incubate with multiple myeloma cells with T cells, effector cells, either from T cells enriched CD3 T cells or PBMC, and follow the time point we assay what is the capacity of AMG 701 induce multiple myeloma cell lysis in the presence or absence of bone marrow stromal cells or osteoclast. Both are two components, very important components to protect myeloma cells in the bone marrow microenvironment, and also play a very significant role to induce myeloma resistance to current therapies. And the result, we found that AMG 701 can potently induce myeloma cell lysis regardless of those factors that either I just mentioned, bone marrow stromal cell, osteoclast. They can very significantly induce myeloma cell lysis, not just sensitive cells, but also resistant cells, especially we have the data demonstrating resistance to IMiD immunomodulatory drugs such as lutetiumab, pomalidomide, or botulism. And in addition, we also follow up the T cell activation and proliferation and differentiation to see whether this AMG 701 can induce T cell proliferation differentiation in the presence of myeloma target cells. And we found that it is significantly induce T cell differentiation activation, and that is validated by cell proliferation assay specifically gated on the CD3 proliferated cells that we quantitate central memory and effector memory cell portions, and we all found that AMG 701 can induce EM and the CM subset of T cells upon treatment. And this is time dependent. There's a time dependency. At day 7, the induction is even higher. And when we evaluate CD8 portion ratio to CD4, we also found that CD8 increment is much more significant than CD4, which is supporting data since the CD8 subset of T cells are the main killer cells to lyse tumor. Because this is a bispecific T cell engager, so it's a little bit different from CAR T cells. CAR T cells is active, so you transfect your vectors into the T cells, and it's not off-shell. But AMG 701 is an off-shell product, so when you need it, you can administrate it. And when you don't want it, you can just withdraw it. So I think in terms of toxicity, perhaps this approach will be more feasible. And in fact, the first BCMA BiTE that's called AMG 420, although it has much poor pharmacokinetics compared to AMG 701, the clinical trial first in human clinical trial has already shown very impressive response rate, 70% response rate in a very heavily pretreated myeloma patient populations that was just reported this year in ASCO and the IMW meeting in September. And I think this is this is precedent, and this is set the stage for us to evaluate this better improved molecule with because it contains a Fc portion leading to higher, longer half-life in the patient's serum. So presumably, we are hoping that this molecule can allow once per week injection into the patient, which will be much favorable. Next for the study, I forgot to mention, because we also have in vivo data to support to combine AMG 701 with immunomodulatory drug, lidocaine or pomalidomide. We just present the data at 10 o'clock that actually we have very systematically approach that we demonstrate in the presence of lidocaine, pomalidomide, AMG 701 induced myeloma cell lysis is further enhanced, and that can also overcome my bone marrow stromal cells or osteoclast protected effect. And in the in vivo model, we further use suboptimal doses of AMG 701 in the presence or absence of lidocaine, and we observe under these conditions, only combination group can further regress tumor regrowth compared to the monotherapy alone group. So I think all those data provide further evidence or warrant future combination trial of combining AMG 701 with lidocaine or pomalidomide, which has already been standard care of therapy in multiple myeloma to further eradicate minimum residual diseases to prolong or extend durability such therapy and hopefully cure the disease. That's what we are hopeful.